Hello everyone, welcome back to my channel. So today I'm going to deal about the management of the first stage of labor. So previously I have dealt about the definition of the labor. So today I'm going to deal the management of the first stage of labor, which is also the important part of the exam in the OBJ. So what is the management of the first stage? Before that I would like to review the definition of the labor. So with the diagram only. So this is a genital organ. So events is taking place in a genital organ in an effort to expel the product, which is in a red color, out of the womb, which is a yellowish color, through the vagina into the outer world. So this definition I'm sure that everyone has understood well. So I will not go furthermore. So now next is the management of the first stage of labor. Before heading to the management of first stage, we should know about the what is the goal, why we are doing the management in the first stage of labor. We can do with the whole part of the labor, but we are considering the first stage of labor because there are three aspects that we should love. So I have kept the diagram progress of the labor, which is the first part, and then second and third, the mother well-being and the baby well-being. These three major goals placed in the management of the first stage. So what is the aim you can mention is to assist the maternal and the fetal well-being through the first stage of labor and to facilitate the progress of labor. Here diagram I mentioned, right? And the fetal and maternal well-being. An additional point also you can add is to identify the factors that may influence the ongoing management of the woman and her baby. So in case if you are forgotten in the exam how to write the goal, then you can just recall with the diagram progress of the labor and maternal and the fetal well-being. So now there is a 14 points that you should note down in the first stage of management. Many of the students are not able to recall or they are not able to make the 14 points, which is the must needed in the first stage of management. So I have mentioned the 14 points here and I will give you in a simpler form as well. So first one is assessing the admission. As we are taking the patient in the hospital, how we are taking that, similar to that, the management of the first stage will be considered. So assessing admission should be done. After that, maternal assessment can be done, then only the fetal can be considered as a healthy state. And what all different criteria needed are fluid management, which also include the food, bladder management, perineal shaving, vaginal examination, emotional support, ambulation, PARTOGRAPH. And this PARTOGRAPH I'm going to deal more elaborate in the and another videos, and amniotic fluid, uterine contraction, medication and records. This 14 points I make it into the acronyms which I made in this way, so hopefully you will get the easy idea to recall during the exam. So now next is this is a diagram which I made it with the concept of assessing the admission. In case you have forgotten assessing the admission, you can just recall the gray circle, which is considered as a hospital, which always takes the admission of the patient. So now next is a maternal assessment. Maternal assessment is in the yellowish color, which consists of all the needs of the maternal only. So in case mother is coming for the admission, what she should take is obviously she should take food and fluid management. Once she is taking those things, what will happen is mother will get the bladder filled. So then we should give the bladder management. And once the bladder is filled, further mother should be needed a perineal shaving. This is a way I'm giving you the easy idea to recall the management of the first stages of labor. So further perineal shaving is done, then vaginal examination can be done by the physician as well as the medical profession personnel. And furthermore, since a mother is exposed the private part, then she obviously need a emotional support, and then further she should be ambulated or she should make the walk to reach her bedside. So this is a way to recall, but the major point you should explain, and also I will explain in the another slides. And now next is a fetal assessment. Fetal assessment, we will assess only the fetal heart rate and the fetal movement, which will be used by the NST as well as the CTG. And third point is a PARTOGRAPH, which I will be dealing more in another videos, and also I will explain little bit in these slides as well. So in a PARTOGRAPH, usually there are four components that we will look into. There is the amniotic fluid, color, and uterine contraction, which is also called the pain of the labor, and medication. What medication will be given in the first stage of labor, and recording. These all events should be recorded is the management of the first stages of labor. Now next is the assessing the admission. Assessing the admission, as we the nurse as well as the medical profession, we all are doing the admission. When we are taking the admission, what we will do is a medical and the obstetrical history, because it is in OBG, so we should take the obstetrical history. And we should also assess about the rupture of the membrane. So rupture of the membrane, it will be either spontaneous or the induced. And clothing to change in the when the patient are admitted to the hospital, and recording whatever things are done for the patient should be recorded in the patient file. So assessing admission, we should mention this point. And further, maternal assessment, which is a second point. Maternal assessment, fluid and food management. Fluid and food management is this one. Mother is taking the consumption of the food should be less, because it will induce the vomiting. So fluid also mother should be given during the first stage. Mother should not be dehydrated, so should be given more of the fluid. And bladder management should be done. Bladder management to prevent from the interruption of the uterine contraction. Bladder management should be done appropriately, or should be catheterization can be done. And perineal shaving also can be done to prevent the infection. It is mostly done with the mons pubis, vulva, and the related region. And vaginal examination also can be done to see the progress of the labor, as well as dilatation of the cervix and the events of the labor. And emotional support should be given to the mother regarding the assurance, and non-judgmental attitude should be provided by the nurses. And ambulation should be provided for the nurses, provided by the nurses to the mother as well. This will enable the labor to take place in an effective way. So this thing management should be done. This bladder management, and this is a perineal shaving, and this is a emotional support, and this is a ambulation, or making the mother to walk. And now next, fetal assessment. As I have said, fetal heart rate and the fetal movement should be checked in the fetal assessment. And PARTOGRAPH, which I will be telling more in the further videos. So PARTOGRAPH is just a graphical composition which will record all the progress of the labor, and PARTOGRAPH already consists of these components, which should be noticed in the first stage as well. So amniotic fluid, what we should see is the color of the amniotic fluid. If the color is clear, it's a normal. If it is green, consider there it's a meconium. Either the baby is distress or hypoxia, lacking of oxygen for the fetal. So amniotic fluid color should be assessed. Uterine contraction frequency and the duration should be assessed. If the uterine contraction is too much, then the oxytocin or the medication should be reduced, or if it is less, then can be given with the inducing the medicine can be given. And medication, whatever the medication like oxytocin, pain, everything should be mentioned with the name and the dosage in the PARTOGRAPH. And recording this all PARTOGRAPH events of the amniotic, uterine contraction, medication should be recorded appropriately. So these are the management of the first stage of labor. Thank you so much.